in Hollingake.
Thank you, Madam Deputy Speaker. It's a pleasure to follow my honourable friend for Stoke-on-Trent, and I absolutely agree with him that this is probably the least worst option. I feel saddest about this debate. So many constituents have come up to me in recent years and said, when it comes to the big issues, the issues of national interest, why is it you lot can't work together and come up with a solution? And clearly this is of huge national interest, and it's been debated in this House many, many times over recent decades, and dozens of times I've been involved in the 6 years I've been in this House. And I blame actually colleagues from either side of the House, either party, for doing this. When it comes to whether it's the death tax or dementia tax, people have come forward with proposals just to be rubbished by the other side for political purposes. The reality is this is one of many challenges we're going to face over the next few decades. According to the Office of Budget Responsibility, if we don't change our tax system, our debt to GDP ratio will be 400% of GDP by 2060 because of pension costs, because of healthcare costs, because of social care costs. So we must sort this across the House so we do have a long-term solution. The reality is we have had cross-party consensus. I took part, as I've said a number of times in the last couple of days, in two Select Committee inquiries, the last one a joint one with the Health Select Committee and the Local Government Select Committee, 24 members of that committee, 12 from the opposition benches, and we came with the solution that was strongly recommended, that was based upon national insurance. And of course, we can argue some of the detail of the national insurance actual proposal, and that's been changed, I think, in some positive ways over recent days. But to simply dismiss this out of hand for political purposes is irresponsible, in my view. Also, I understand that the Shadow Social Care Secretary has also proposed a solution based upon national insurance. So it just does not make sense for simply to say this is wrong for political purposes. And the Shadow Minister can shake her head, but that's the reality behind this proposal. The Chair of the Select Committee, Local Government, said it quite clearly that he still supported a solution based upon national insurance. So I agree with my honourable friend, this is a least worst option solution. I think there are better solutions we can develop down the line. I agree with my honourable friend for Bexhill and Battle. The German solution is a better solution, and they did come together based upon the national interest and cross-party to solve this issue. It's very similar, employer and employee. The key benefit of their solution is when you come as defined as needing care, instead of having care allocated by the local authority, you can choose to take a cash payment, a monthly payment. So you can then pay that to a relative, to a neighbour, whoever, to give you that care. So you can be cared for by the people who know you best, who understand you best, and love you the most, which must be better than some of the stories we hear about care providers who give a pretty poor service in terms of a 15-minute package here and now and then. That must be a better solution. The one concern I have about this, I understand why it's been brought forward like this using national insurance, because it's quick and easy, we need the money today. But the concern is about hypothecation, and many members have mentioned this. This was a social care levy. Already some of it is going to the health service. That's how I understand it at the start. Hypothecated taxes simply do not work, but that's what happens time and time again. This would be better to be developed into a proper social insurance system with not-for-profit providers, so it doesn't go into the private sector, but really could mean this money was paid in on a proper hypothecated basis to deal with that long-term problem of social care.